This video presents inspection and palpation of the breasts, areolae, and nipples, and inspection and palpation of the axillae. In the video, you'll see the examiner assess a healthy patient. In clinical practice, you may detect the same normal findings, or you may discover normal variations or abnormal findings. Before examining the breasts, let's review the important structures. Each female breast lies between the second and sixth ribs and between the sternal edge and the mid-axillary line. Note that the tail of the breast extends into the axilla. About 2/3 of the breast overlies the pectoralis major. The other third is superficial to the serratus anterior. The breast is composed of glandular tissue, fibrous tissue that supports it, and fat. The glandular tissue is organized into lobes that radiate around the nipple. The ducts from these lobes open onto the surface of the nipple. The nipple and the surrounding areola are pinker or darker than adjacent skin and are somewhat lateral to the midline of the breast. For descriptive purposes, the breast may be divided into quadrants. The breast may also be visualized as a clock face so that a lesion can be located by time and by its distance in centimeters from the nipple.
First, I'd like to begin by examining your breasts. I'd like to start first with inspection.
To begin the examination, inspect the breasts with the patient seated and her arms at her sides. The size and shape of normal breasts vary widely as a result of heredity, age, nutrition, endocrine activity, parity, lactation, and pregnancy. Inspect the skin over the breasts, noting any abnormalities, such as redness or thickened skin with prominent pores. Also observe the breasts for symmetry of shape and size. Some difference in size is common and usually normal. Then inspect the contour of each breast carefully to detect any masses, dimpling, or flattening. Next, inspect the nipples and areolae, noting their size and shape. Look for rashes, ulcerations, discharge, or any asymmetry of the directions in which the nipples point.
Next, can you raise both arms above your head?
Then use two arm movements that may bring out skin dimpling that suggests an underlying lesion such as cancer. First, ask the patient to raise her arms over her head.
Okay. Now lower your arms and press them against your hips.
Next, ask her to press her hands against her hips. With each movement, inspect the breast contours carefully. When the patient's breasts are large or pendulous, a third position is useful. Ask the patient to stand and lean forward, supported by your hands or by a chair. Her breasts should hang free from the chest wall. Look for dimpling of the skin and retraction of the nipples. None are seen here. With the patient lying down, place a small pillow under her shoulder on the side you are examining and ask her to rest her arm above her head. These actions help to spread the breast tissue evenly over the chest.
How often do you check your breasts?
About once a month.
Have you noticed any lumps or discharge?
No.
Okay. I'm going to lower your gown and examine your right breast first.
Okay.
Next, with your fingers flat on the breast, compress it gently against the chest wall. With the pads of 3 fingers, palpate in a smooth rotary motion, assessing the breast tissue for consistency, tenderness, and nodules or masses. Use a systematic pattern, such as concentric circles, clock times, or parallel lines, to palpate the entire breast. A pattern of parallel lines is demonstrated. Complete palpation of the breast by examining the tail. Although normal breasts may be diffusely lumpy, Try to identify any nodule or mass that is larger or different from the rest of the breast tissue. Note its location, size, shape, consistency, and tenderness. Is it well circumscribed or not? When you try to move it, does it seem mobile? And does the nearby skin become dimpled, suggesting an underlying lesion such as cancer? Next, palpate the nipple, noting its elasticity. If the patient had reported spontaneous discharge from the nipple, compress the breast and areola with one finger that points to the nipple. Continue in a radial pattern around the nipple, trying to identify the source of the discharge. Shift the pillow to the opposite side and examine the other breast. This time, the pattern of concentric circles is demonstrated.
I'm going to be examining your chest now.
Although examination of the male breasts may be brief, it should not be omitted. Inspect the breasts for symmetry and size, and inspect each nipple and areola for nodules or ulcerations. Then palpate the areola for nodules. If the breast appears large, try to distinguish soft fat from the firm disc of glandular tissue. Repeat on the other side. Before assessing the axillae, let's consider their lymph nodes. Of all the axillary nodes, the central nodes are most often palpable. Lymph from 3 other groups of nodes drain into the central nodes, but they are not often palpable. These are the pectoral nodes, which drain the anterior chest wall and most of the breast, the subscapular nodes, which drain the posterior chest wall and some of the arm, and the lateral nodes, which drain most of the arm. From the central nodes, lymph flows on to the infraclavicular and supraclavicular nodes.
Can you raise your left
With the
arm?
patient's arm raised, inspect the left axilla, noting any rash, infection, or unusual pigmentation.
Okay, you can lower your arm.
After the patient lowers her arm, support her left wrist with your left hand and ask her to relax her arm. Now palpate the patient's left axilla by cupping the fingers of your right hand together and reaching as high as possible toward the apex of the axilla. As you bring your fingers down, try to feel the central nodes against the rib cage. Note their size, shape, consistency, mobility, and tenderness. If the central nodes feel abnormal, or if there are lesions in their drainage area, feel for the other groups of axillary nodes. For the pectoral nodes, feel inside the anterior axillary fold with your fingers while your thumb stabilizes the tissue from in front. For the lateral nodes, feel high in the axilla along the upper humerus. For the subscapular nodes, step behind the patient and with your fingers deep inside the muscle of the posterior axillary fold, feel near the edge of the scapula. Again, your thumb provides stability. If you find any signs of malignancy or inflammation in the breasts, or if the axillary lymph nodes are enlarged or tender, examine the infraclavicular and supraclavicular nodes.
Can you raise your right arm now?
Repeat the axillary examination on the right side, beginning with inspection. Then, supporting the patient's right wrist with your right hand, palpate with your left hand. Again, feel for enlargement of the central nodes, and, if indicated, the other axillary nodes. In summary, Examination of the breasts and axillae involves inspection and palpation of the breasts, areolae, and nipples, and inspection and palpation of the axillae.